The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Arthritis of the Finger, Hand, and Wrist by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I am a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In today's video, we will be discussing arthritis of the finger, hand, and wrist. What it is, how to diagnose it, and how to treat it. We will give you some simple self-diagnostic tools as well as some simple home treatment remedies which may save you that initial doctor's office visit. So first of all, what is arthritis? We've all heard of osteoarthritis and rheumatoid arthritis, but there is a whole family of inflammatory type arthritides, such as rheumatoid arthritis. Rheumatoid tends to be the most common and the one that we hear the most about. Although osteoarthritis is significantly more common. 100% of human beings will develop osteoarthritis if they live long enough. It is general wear and tear arthritis, and it can affect any joint in the body. Part of how severe and how soon you form arthritis has to do with your genetic makeup. It has to do with histories of trauma in the past. It has to do with the type of work you've done throughout your life. So it's really a combination of factors, how quickly and how severely you develop arthritis. Whereas rheumatoid arthritis and the family of inflammatory type arthritises, those typically are associated with autoimmune diseases, where your body attacks itself or attacks the joint or the soft tissues around the joint, causing joint inflammation and joint destruction. That can occur anywhere from childhood all the way up into the 80s and 90s. And that's something that we won't discuss a whole lot here in this video, as we're going to focus primarily on osteoarthritis. So the most common joint in the hand to develop arthritis is the distal interphalangeal joint, the little joints at the end of the fingers. Knobby, swollen finger joints that may or may not be painful in folks generally past the age of 40 or 50 is typically arthritis of the DIP joints. The second most common place in the hand to develop arthritis is what's called the basilar joint of the thumb, or the CMC joint of the thumb. Because this joint has so many degrees of freedom to allow us to do all the things that we can do with our hands, this joint tends to get a lot of use and therefore accelerated wear. And this joint tends to start wearing out typically in the fifth decade of life. This one tends to be painful. Arthritis here at the end finger joints, the DIP joints, sometimes it's painful and sometimes it's not. We can also develop arthritis of the PIP joints or of the MP joints, or there are little joints in the wrist. There are 8 small bones that make up a very complex set of joints in the wrist. We can develop arthritis there. We can develop arthritis where those 8 bones meet the radius and the ulna, the forearm bones, and give us wrist flexion and extension. Or we can develop arthritis anywhere in between. Rheumatoid arthritis tends to affect the MP joint primarily, and osteoarthritis tends to spare those joints. Osteoarthritis tends to affect the DIP and PIP joints as well as the basilar joint of the thumb. Sometimes arthritis in the wrist can come from either rheumatoid arthritis or any type of inflammatory arthritis or osteoarthritis. However, very often that's associated with a post-traumatic arthritis, and that's really a third type of arthritis that we didn't initially discuss. That can be due to a fracture or an old trauma. So if there's a bone broken in the wrist that never heals quite right or that doesn't heal at all. Sometimes in the case of a scaphoid fracture, for example, those bones can rub in a non-anatomic fashion as we move the wrist. And with years of that, patients can develop a very specific type of arthritis in the wrist called SNAC, S-N-A-C arthritis. Or if there's a torn ligament in the wrist, the scapholunate ligament, those bones will flex and extend non-anatomically, and that can lead to a very specific type of arthritis in the wrist called SLAC arthritis, S-L-A-C. Both of those are post-traumatic types of arthritis. With rheumatoid and the other inflammatory type arthritides, this aspect of the joint over here tends to be affected as well, as are the little bones in the middle of the wrist. The midcarpal joints tend to be attacked and destroyed in rheumatoid arthritis. So some simple home diagnostic tools to really help hone and pinpoint where your arthritis is coming from is just palpation of that area. So visualization and palpation. So really hone in on where your source of pain is. See if there's any lumpy bumpies associated with that, which is typically a bone spur underneath the skin, or sometimes some soft tissue swelling around an inflamed joint can cause some of the lumpy bumpiness. But really try to pinpoint in on where your pain is. For CMC joint arthritis, for example, patients tend to be sore right here at the base of the thumb. They tend to have pain with a grinding motion. For some of the other joints of the hand, just pain with motion of that joint tends to be indicative of where the arthritis is coming from. And oftentimes in the hand, multiple joints are arthritic. And sometimes they are non-painful for very long periods of time, and then you have a minor trauma, a minor fall, something, and it flares up this underlying arthritis. Patients come to see me and I'll get an x-ray of their hand and I'll say, you have terrible arthritis in this joint or that joint. And they'll say, well, I don't know, doctor, I'd never had pain before. Although this arthritis has probably been there just slowly smoldering and building for years and years and years, and now it's just suddenly become painful. So, excuse me, how do we treat arthritis of the hand and wrist? It really depends on how severe the symptoms are. Some simple home treatment remedies, as we've discussed in the other videos, are activity modification, which again patients don't necessarily like to hear, but essentially if it hurts, don't do it. So rest the joint, that decreases inflammation and that helps with pain. By placing yourself into a brace or a splint, that forces you to rest that joint and helps with the pain.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.